Hello class. Today we are finishing up A&P with our last chapter, Chapter 22, Growth, Development, and Aging. Our objectives are to discuss the concept of development as a biological process characterized by continuous modification and change, discuss the major developmental changes characteristic of prenatal stage of life from fertilization to birth, identify the three primary germ layers and several derivatives in the adult boy that develop from each layer. Discuss the three stages of labor that characterize a normal vaginal birth. List and discuss the major developmental changes characteristic of 4 postnatal periods of life, and then discuss the effects of aging on major organ systems. The prenatal period begins at conception and continues until birth, which is about 39 weeks. The science of fetal growth and development is called embryology. Embryology is the story of biological marvels that describes how a single microscopic cell transforms into a human being. Now, fertilization to implantation requires about 10 days. It normally occurs in the outer third of the oviduct. And the fertilized ovum, called a zygote, is genetically complete. All that is needed for expression of hereditary traits is time and nourishment. After 3 days of cell division, the zygote has developed into a solid cell mass called a morula. Continued cell divisions of the morula produce a hollow ball of cells called a blastocyst. Now, if you recall, each uterine tube extends outward from the uterus for about 10 centimeters. So that is quite phenomenal that it requires about 10 days and it gets in there and all of this stuff starts going on. This blastocyst then implants into the uterine wall about 10 days after fertilization. The blastocyst forms the amniotic cavity and the chorion of the placenta. The placenta provides for exchange of nutrients between the mother and the fetus. Fertilization and implantation. So this goes to show where the ovary, and you can see where the ovulation is going of the ovum, and it goes and it gets attached in these finger-like projections of the fimbriae, and it goes up into the tube, and then it becomes a spermatozoa, starts to divide. The zygotes go into the morula, goes down into the uterus as a blastocyst, and then it implants. Implantation and early development. This is basically what this is showing, and it shows how the implanted blastocyst has got an inner cell mass, amniotic cavity, yolk sac, shows all the glands. Now the amniotic cavity and the placenta, let's talk about these. As the blastocyst develops, it forms a structure with a yolk sac and an amniotic cavity. The amniotic cavity becomes fluid-filled, shock-absorbing sac, sometimes called bag of waters. And the placenta is composed of tissues from the mother and the child. Now the length of pregnancy or gestation period is about 39 weeks. Embryonic phase extends from the 3rd week after fertilization to the end of week 8 of gestation. Then the fetal phase extends from week 8 to week 39 of gestation. All organ systems are formed and functioning by month 4 of gestation. This gets to show you a little of what it looks like on the inside. A shows the human embryos and fetuses at 35 days. B is at 49 days. C is at the end of the 1st trimester, and D is at 4 months. Formation of our primary germ layers, or stem cells. These are unspecialized cells that reproduce to form specific lines of specialized cells. There are three primary germ layers that appear in the developing embryo after implantation of the blastocyst to the uterine wall. We have the endoderm, which is inside, inside. We have ectoderm, which is outside layer, outside. Then we have the mesoderm, which is the middle layer, middle. Each germ layer gives rise to definitive structures such as skin, nervous system, tissue, muscles, or digestive organs. Now, adult stem cells remain after early development, but can only produce a few specialized kind of cells in a particular tissue, unlike what happens in the embryo. Now let's go into histogenesis and organogenesis. Formation of new organs is organogenesis, and tissues is histogenesis. And this occurs from specific development of the primary germ layers that we just learned about. Growth processes include cell differentiation, multiplication, growth, and rearrangement. From 4 months of gestation until delivery, the development of the baby is mainly a matter of growth. Human development begins when two sex cells unite to form a single-celled zygote. And the development of structure and function go hand in hand in this process. Now, what are birth defects? Birth defects are any structural or functional abnormality present at birth. It may be caused by genetic factors such as abnormal genes, abnormal number of chromosomes. It could also be nutritional deficiencies during pregnancy. Then we have external factors, which could be environmental factors called teratogens, and these include radiation, chemicals, and infections. And then we have the fact that all of this is especially harmful during our first trimester. This shows critical periods of neonatal development. The red areas show when teratogens are most likely to cause the majority of the birth defects, and the yellow areas show when minor defects are likely to arise. And these are numbers refers to the weeks of gestation. So you can see where damage to central nervous system continues throughout, and it starts to fade away a little bit around 36, 38 weeks. So you can see where the heart, upper limbs, lower limbs, ears, eyes, those are all within those first weeks of development. Now let's talk about parturition. This is the process of birth. At the end of week 39 of gestation, the uterus becomes irritable. The fetus takes a head-down position against the cervix, with the spine towards the front of the mother's abdomen. The muscular contractions begin, and labor is initiated. This is where that positive feedback loop comes in. The amniotic sac or bag of waters ruptures. The cervix then dilates and gets bigger, and the fetus moves through the vagina to the exterior. Now, a breech birth is when the fetus fails to turn head downward. This is where the bottom or the feet are first. That's putting pressure on the cervix. This condition typically requires the baby to be born via C-section. So this shows the labor, and you can see how the baby is turned and head down, the spine's away from the mother's spine. So then the amniotic sac ruptures, cervix of the uterus dilates. Dilation of the cervix is complete. Rupture in the amniotic sac widens. The fetus is expelled from the uterus and through the birth canal, and the placenta is expelled. Now, stages of labor. We have stage 1, and this is the period from the onset of uterine contractions until the dilation of the cervix is complete. Stage 2 is the period from the time of maximal cervical dilation, so the cervix is dilated to the max, and until the baby exits through the vagina. This is stage 2. Stage 3 is when the process of expulsion of the placenta through the vagina happens. So, of course, labor is the birth of a baby. And to assess general condition of a newborn, a system that scores 5 health criteria is used, and this is called an APGAR system, or APGAR score. The highest APGAR score is 10, so the higher the better. Now, growth, development, and aging. The postnatal period begins at birth and lasts until death. Divisions of the postnatal period into isolated time frames can be misleading. Life is a continuous process. Growth and development are continuous. Obvious changes in the physical appearance of the body, in whole or in proportion, occur between birth and maturity, and there are divisions of the postnatal period. Gradual changes in the physical appearance of the body as a whole and as in relative proportions of the head, trunk, and limbs are quite noticeable between birth and adolescence. So what are our postnatal periods? Infancy, childhood, adolescence, adulthood, and older adulthood. So here you can see from a newborn to 2 to 5 to 13 to an adult. It's dramatic. The first 4 weeks of infancy is called the neonatal period. Neonatology is medical and nursing specialty concerned with the diagnosis and treatment of disorders of the newborn. In this neonatal period, the baby is referred to as a neonate. Many cardiovascular changes occur at the time of birth. The fetus is totally dependent on the mother, whereas the newborn must immediately become self-supporting in respect to respiration and circulation. Developmental changes between the neonatal period and 18 months include respiratory changes at birth that include a deep, forceful first breath. That is that joyous sound that we hear. Then we have doubling of birth weight by 4 months and tripling by 1 year old. We have 50% increase in body length by 12 months. Development of normal spinal curvature around 15 months. The ability to raise the head by 3 months. To crawl by 10 months. And to stand alone by about 12 months or a year. By 18 months, the infant typically has the ability to run. Now let's talk about childhood. Childhood extends from the end of infancy to sexual maturity or puberty. This is 12 to 14 years in girls and 14 to 16 years in boys. By age 6, the child appears more like a pre-adolescent than an infant or a toddler. By age 10, the child has developed numerous motor and coordination skills. The deciduous teeth, which begin to appear around 6 months of age, are lost during childhood, beginning around the age of 6. And the permanent teeth, with the exception of wisdom teeth, all erupt by age 14. Now let's talk about adolescence. Average age range varies, somewhere between 13 to 19 years. The period of rapid growth that results in sexual maturity is known as adolescence. Appearance of secondary sex characteristics regulated by secretion of sex hormones. In girls at about 10 years old, breast development is often the first sign of approaching puberty. Most girls begin to menstruate at 12 to 13 years of age. And in girls, the spurt in height begins between 10 and 12 and is complete by 14 or 15. Whereas in boys, the spurt begins around 12 and 13 and is complete later at the age of 16. Growth plates fully close in adult, and other structures such as the sinuses assume adult placement. Once we reach adulthood, degeneration of body tissue begins. So what is adulthood? It's characterized by maintenance of existing body tissues. So we're just maintaining what we got. This gives an idea of the height difference. Girls usually faster than boys. Now in the older adult, we see degenerative changes that characterize older adulthood. Now the study of aging is called gerontology. And the degenerative changes that characterize this older adult is known as senescence. Every organ system of the body undergoes degenerative changes. Senescence accumulates in death. So what happens as an effect of aging? Well, our integumentary or skin with age begins to sag, becomes thin, dry, and wrinkled. Pigmentation problems develop and are common, and frequently we begin losing or thinning hair. Skeletal system. Aging causes changes in the texture, calcification, and shape of bones. Bone spurs develop around joints. Bones become porous and fracture easily. Degenerative joint diseases such as osteoarthritis are common, and physical activity can reduce the loss of bone mass and mobility. Loss of bone mass and reduced mobility can be avoided or reduced if we continue to stay physically active coupled with good nutrition. So this means exercise. Older bones develop indistinct and shaggy appearing margins with spurs that are called lipping. So what about our central nervous system? Well, advancing age increases the risk of dementia. Dementia is the loss of memory and other functions of conscious thinking. Most have intact memories and have developed mature ability to reason and make decisions, and then some elderly end up progressing into a depressive state. What happens to our special senses? Well, as you most know, most of the time as we age, we begin to need glasses, right? Sometimes this need becomes bifocals to assist with near and distant vision. All sense organs show a gradual decline of performance with age. Eye lenses become hard and cannot accommodate for near vision. This results in farsightedness in many people by the age of 45, which is presbyopia or the old eye. And then we have a loss of transparency of lens or cornea, and this is a cataract. We have glaucoma, which is the increased pressure in the eyeball, is often the cause of blindness in older adulthood. So any or all of these could happen. Or we could even have an increased risk of retinal degeneration or detachment. We have a loss of hair cells on the inner ear, which produces frequent deafness in many older people, I apologize. Decreased transmission of sound waves caused by the loss of elasticity of the eardrum, and fixing of the bony ear ossicles is common in older adult. Some degree of hearing impairment is universally present in the aged. Smell and taste may be reduced, and only about 40% of the taste buds are present at age 30 actually remain at 75. Also, you may note a loss of appetite as we age, partly because of the replacement of taste buds with connective tissue cells. So we don't taste food as much, we don't want as much of it, it's just not quite as enjoyable. Cardiovascular system changes. We have degenerative heart and blood vessel disease is amongst the most common and serious effects of aging. Fat deposits in blood vessels called atherosclerosis, and it decreased blood flow to the heart and may cause complete blockage of coronary arteries and could cause these heart attacks. Hardening of arteries, which is arteriosclerosis, may result in a rupture of blood vessels, especially in the brain, that can cause a hemorrhagic stroke. Hypertension or high blood pressure is also common in older adulthood. With advancing years, a generalized atrophy or wasting of muscle tissue takes place as contractile muscle cells are replaced by connective tissue. Respiratory changes causes calcification of costal cartilages that cause rib cage to remain in an expanded position. When the rib cage remains in this expanded position, respiratory efficiency decreases, and this condition can result in what's called a barrel chest. We have wasting of respiratory muscles that decreases respiratory efficiency, and respiratory membrane thickens, and movement of oxygen from the alveoli to the blood is slowed. And finally, we come to the last system, which is our urinary system. Urinary system, the nephron units decrease in number by 50% between the age of 30 and 75. Blood flow to the kidney decreases, and therefore ability to form urine decreases. Bladder problems such as inability to void completely are caused by muscle wasting in the bladder wall, or we could end up with muscle atrophy in the bladder that results in decreased capacity and inability to empty or void, so they retain some urine. We also can create so much atrophy that we end up with such weak muscles that urinary incontinence can also occur. Does not always. It is not always an effect of changing, but it can occur. Okay, well, thank you again for being with me today for this lecture. Review chapter 22 in your book. Review your chapter summary and do your questions. It has been a pleasure producing these videos and discussing different things with you students via email or phone. And I wish you nothing but the best. Happy studying.